College of. Okay, so okay. Uh, Let me start over then. I'm pleased to introduce Dr. Mazin Al-Khafiji, a distinguished doctor of Chinese medicine, graduated from the Shanghai College of TCM in 1987, not too long ago. Dr. Al-Khafiji has dedicated his career in the treatment of autoimmune, allergic, and skin disorders. He is a globally recognized lecturer in this field and has led the dermatology diploma program in Europe and North America for over 2 decades. Additionally, he has developed a dermatology range of topical products and herbal cosmetics designed to address common skin disorders. Mazin is also the co-author of the internationally acclaimed textbook, A Manual of Acupuncture. So it's not the Denman book, but it's the Mazin book, just so you guys know. Anyway, I'm without further ado,
Thank you.
Mazin.
Okay, hello everybody. Pleased to be here. Okay, so I'm going to talk actually about external applications in Chinese medicine, rather than specifically about dermatology. So I've tried to keep this lecture just simple, because I didn't know who the audience was, and really will describe how we use external medicines for some common diseases. External therapy must be the oldest form of treatment, I would say, going back thousands, if not tens of thousands of years. And certainly there is evidence of this. Back in the Shang dynasty, that's almost 4,000 years ago, where disease names and medicinals were carved onto these tortoise shells and bones and passed on from there. So that's when writing was available, but there's a number of characters that are still in use today, actually. For example, the character for psoriasis, character for other conditions, and medicinals that are used. And those initial ones were primarily for external application. Before that, it's unknown, of course, because there's no evidence, no writing, no evidence of this. But as has been recently publicized, chimpanzees have been shown to pick medicinal plants, chew them, and apply them to wounds in diseased areas, really in quite an extraordinary way. Or they can pick up insects that they don't usually eat, because they do eat insects as well, but they squish them and apply them to wounded areas or disorders of the skin. And not only do they do that themselves, they also do it to each other. So when maybe the wound is not easily reachable, you get your friend to apply this chewed up leaf or insect. And not just chimpanzees and bonobos, which are very close to us, but also things like orangutans and other primates do exactly this. So it'll be really strange if humans who've been on this earth for 300,000 years didn't do something similar. Really, topical application must be the oldest form of treatment. And Chinese medicine, of course, since writing was used, this information has been passed on, and very sophisticated it is too. So not only using many different compounds, minerals, and insectiles, and of course, plant materials for certain diseases, but also the way these extractions were made is quite extraordinary, very sophisticated. Either to detoxify, remove poison from these plants, or to enhance their properties. So this really goes back certainly a very long way. And actually, not only for skin diseases, external applications are used in the treatment of babies and adults as well, in particular cases where internal medicine is not suitable or difficult to consume. So I don't know whether you've heard of the umbilical application. So herbs are cooked up and the essence of that's applied to the umbilicus, and close. It's a very successful, effective way of treatment of many diseases. Anyway, so external medicine really is something to be reckoned with. So nowadays, we have also a sophisticated way of extracting essence of plants to really concentrate this in order to be able to use it in an effective way. So here we see, for example, extraction of dampifen. This is a piono. Have you heard of this? Yeah, mudanpi. Actually, also some other ingredients like shuchangqing have this pional, this compound, which is very effective anti-allergic and anti-inflammatory ingredient. So we put this in nose drops and use it for allergic rhinitis very successfully. We also use it in creams for eczema and for allergic contact dermatitis, allergic dermatitis. So once these extractions have been made, we run through a simple way, or nowadays I don't do this, although once upon a time I used to do all this myself. Now we have formulators who mix these compounds in particular ways according to my requirement. And then they run through a process using small machinery where they can make the 2 kilos of the cream or ointment or lotion. And they go through various tests. Yeah, viscosity, for example, how viscous the cream is, the pH of the cream as well. You know, the skin loves, the skin operates at about 4.5 pH, which is quite acidic. So creams really have to be quite acidic to be effective. Also, they're examined for particle size. So if we take, for example, huangbai, which is a common ingredient, huanglian, we grind it into fine powder, and it has to be really fine by these milling machines that we have. You have to reach a fineness of 20 microns. Otherwise, when you apply it to the skin, it will feel rough. Yeah? So this has to be done correctly, otherwise the cream is not very pleasant to use. And then once all of that is done, the creams are tested. So there's a variety of ways of testing stability. They're put into 3 different ovens at different temperatures. This will mimic degradation that you see over a 2-year period. Yeah, so if it's held at 45 degrees for 3 months, I think it'll be equivalent to a 2-year degradation. Also, UV light these lotions and creams are tested, see how they react with sunlight. And once we're satisfied with all of that, then it goes to the big machine where we can make about 30 kilos at a time. That's about 60 pounds or so in Europe. Yeah. So in a single day, you can run this machine about 4 times. So you can make 120 kilos, a lot of cream in one sitting. This is a medicated oil, which has zhizao and dangui. It's a very famous combination. Actually goes back to the Tang dynasty. They call it the purple cloud ointment. You find this type of combination or variants of this all over China, because it's a very effective medicine to stimulate proper function in the body. And I'll talk more about this cream later on. So this is really our best seller, I would say. We'll pass this round. So we call it nourishing cream. It has various other ingredients in it, but in essence, it's zhizao and dangui. Here it is being made. Yeah, we have a dedicated production unit, so where there's things like positive pressure and filtered air and filtered water and such like, where the creams are made. And they're all packed by hand, you can see here, and labeled. And in all, we have about 70 or 80 different products by now. Yeah, so once upon a time, I just made these myself using a coffee grinder and cooked it in the kitchen and so on and so forth. But step by step, it's graduated until we have this big production. And we make also lotions and creams and suppositories and all manner of things like this. Okay, so that's just a background to the creams that we make or the products that we make. What I'm going to do now is just introduce you to a few common diseases. And of course, when it comes to skin disease, then you have access to the disease itself. Not only do you prescribe internal medicine, but if you can use topical ingredients to dampen down the inflammation or reduce the itching, this is very, very useful. So mostly the vast majority of patients that I see, the skin patients, will get internal medicine. And topical medicine is an adjunctive therapy, which will help speed up the process. But what I've done for this talk is just choose patients who, for one reason or another, only use external applications. So you'll get a less rapid response, but nonetheless, it's a very useful one. So I'm going to just introduce some of these common diseases. First is atopic eczema, atopic dermatitis. This is a very common condition. In traditional Chinese medicine, it was named Soanfeng, Wind the Four Crooks, about 500 years ago. And this is quite extraordinary because in the West, it was only called atopic eczema about 80 years ago. And atopic means strange or peculiar because it was an unusual and peculiar form of eczema. Nowadays, actually, it's easily the most common form. Very, very widespread. It's really reached epidemic proportions in the West. Yeah? So you'll definitely come across this in your practice. It's called Wind of the Four Crooks because it affects typically starts in the four crooks of the body, the backs of the knees and the elbows, as you see here. It can affect any area, really. So eczema is a complex disease, and there are many variants, but in essence, and I'm just going to introduce some simple but very important components, you can say it sits on a spectrum between heat at the blood level and damp heat on the other side. Yeah? And like most of these diseases, with the passage of time, the presence of extreme heat or dampness will damage the blood and the yin. So the third component of eczema is really this. So you have, when you first see a patient and they have active disease, you must decide where does it sit between this hot blood and damp heat spectrum. And as you improve their condition, then you need to consider supplementing blood and yin and also supporting the spleen. So just as a kind of introduction, hot blood is typically seen as what we call a macular eruption, which means it's flat red on the skin. It's dry. It's ill-defined. The area where there's eczema and normal skin is not clearly demarked, as you see here. And this extreme heat at the blood level will generate wind. Wind is a metaphor for itching, amongst other things in Chinese medicine, as you know. So as you can see here, there's a lot of excoriation marks. Yeah, it's always important to mention that when we talk about redness and erythema, we're talking about white skin. With dark skin, you're not going to see redness, rather you see more pronounced pigmentation, as you see here. You can usually only appreciate the intensity of this pigmentation by seeing areas where the skin is not affected by eczema. Here we see it on her feet. The other feature that actually is very important clinically is to discern whether there are papular lesions. In Chinese medicine, whether something is a macula or a papula is really important. Papular is a protruding lesion, and usually tiny, like grains of rice, as you see here, and they protrude above the skin line. So eczema is often a macular papular rash. So there's a mixture of both those things. But particularly for internal medicine, it's very important to decide what proportion of those exist in the patient, because we treat them slightly differently. Again, in darker skin, you won't see redness, rather you'd see pigmented elements. The other really important factor that you'll see with heat at the blood level is when the patient scratches, as they invariably do, you'll get blood scabs. This is actually a very important clinical feature. So you see here all these features. There is excoriation, which means scratch marks. There is macular redness, diffuse, ill-defined. In this case, this is very obviously heat at the blood level. You need to cool the blood, scatter wind. This heat will generate wind. This is another example. Yeah, so that's the dry end of the spectrum. The wet end is, of course, the dampness. And as you'd expect with damp heat, then the heat, of course, is the component of inflammation. The dampness will be presented in a number of ways. One is, of course, exudation, so fluid comes out of the skin. And here you see it again. And also what's called erosion, which really means the top layer of skin becomes macerated and you get down to the dermis. So that's a sign of damp heat. And you can get a mixture, of course, because this spectrum that I'm talking about, it's not either damp heat or hot blood. You'll get a whole spectrum. And your job as the doctor is to decide where the patient sits within all of that. And you need to then construct your formula to manage that. So here you see also this exudation that comes out of the skin will dry and form crusting. So crusting, as you see on her eye, and swelling are also clear signs of presence of damp heat. Here we see again the same thing. The other thing you'll notice is how well demarked these lesions are. So the more demarked they are, the more well circumscribed, the more damp heat is present. Yeah, here's some more example of crusting. Another feature of damp heat is presence of vesicles. So these are blisters under the skin. You can't always appreciate them unless you look close up. And here we can see a lot of blisters just below the surface. Here again is an example of how well demarked damp heat. Even if the skin is dry, if you see a very well circumscribed lesion, then you have to think about the importance of using bitter medicines to drain that damp heat out of the body. I'll talk a bit about what topicals we use, because whether it's damp heat or dry blood or hot blood, you'll need to use slightly different topicals. But just before that, and I hope I'm not going to get too technical about this, but this is really important. If you looked at a cross-section of skin, and there are many things that happen in eczema, but I'm just going to focus on one component, which is the granular layer in the epidermis. So the epidermis is divided into 5 layers. And the penultimate one is called the granular layer. And the granules in this layer produce 2 things. One is ceramides. Have you heard of ceramides? These are waxy substance that the skin produces. And it does a number of very important jobs, including acting as a kind of glue between the cells. It contributes to the skin barrier, so it protects the skin from excessive water loss and protects it from ingress from external pathogens and allergens. It supplies nutrients to the microbiome. So we're covered, of course, in living organisms. So it's the ceramides that give food to these creatures, and they're essential for proper function of skin. They maintain elasticity and suppleness of skin, and they also act as anti-inflammatory when that's needed. The second element that these granules produce, in fact, it produces two things, two proteins. One are called keratin rods, and the other is called the filaggrin protein. I'm not going to talk so much about this thing. Suffice to say that they are deficient in atopics, as are ceramides. Yeah, the people who have this eczema don't produce enough ceramides, nor they produce enough of these proteins. These proteins are really important to create, incredibly, this 14-sided structure to the upper layers of skin. This is now known to be the perfect structure where adjacent cells meet up and there's not a gap in between them. So the ceramides act as a glue in between these things. So these patients with atopic eczema have insufficiency of these features, which means they have gaps in the skin, which means they lose a lot of fluid, and they allow these pathogens to enter, and all the other components that I mentioned. Yeah. So this is a real problem, and it's necessary, of course, to supplement or stimulate the body to produce these things. Now, it's interesting and really quite troubling that topical steroid use, which is the mainstay of modern treatment, depletes ceramides further and filaggrin protein. So these patients are using these steroids to reduce the inflammatory processes, but they set themselves up for further down the line suffering much worse eczema. And this is actually very well documented now. As if that's not enough, there's cortisol and cortisone. The body produces both those hormones. Cortisol is an active steroid. It's produced by adrenal gland. Cortisone is inactive steroid. And the body produces an enzyme known as hydroxysteroid dehydrogenase, which controls the amount of active to inactive steroid in the body. So if the cells in the skin recognize that there's too much steroid, and synthetic steroids are very effective at stimulating that, they'll produce this HDS1, which will convert your own active steroid to an inactive form. Yeah, there's another enzyme that does the opposite. So what happens when steroids are used is that the body downregulates the ability to use its own steroid. So when people stop using the topical steroid, they have a rebound effect. This is very well known as well. Yeah, so these are really a short-term, the conventional treatment is a very short-term approach to treating these problems. Chinese medicine has a much better track record of not only managing to treat eczemas, but actually restoring normal function to the body so you can remove medicine and their skin remains stable. Yeah, there are many clinical trials now that demonstrate that. I'm going to show you a couple of examples where only topical treatment was used. Yeah. So this, maybe you can tell me, do you think this is a hot blood or damp heat case? Yeah, this is hot blood, and heat will generate wind, so these are invariably very itchy. It's also the upper body, which means wind and heat are very important and present. So you see it's ill-defined, it's red and dry. So because she was using a lot of steroids, we used something we called TSW. TSW stands for topical steroid withdrawal. Yeah, we use a TSW lotion. And the main active ingredient here is actually an extract of licorice, gansal. It's a good glyceric acid. So this compound, so when we extract it in concentrated form, it has an effect in efficacy-wise that's similar to mild to moderate steroids. So it has an anti-inflammatory effect. But more importantly, it's able to stimulate the enzyme that I mentioned earlier, this HDS1, to convert your own body's cortisone, which is inactive, into active form. So it stimulates the body to use its own steroid, and ameliorate and reduce this rebound effect that's such a problem with these patients. So that's was used for her. She was also prescribed Mazin Shuigal, which is a, Mazin, this herb? It's a very fleshy, leafy plant, which is very effective for topically for eczema, and internally actually very good for inflamed bowel as well, for IBD. She was given that to use, and then, as all patients are given, is this pink cream that I passed around. This is to begin to stimulate ceramide production and this filaggrin protein. Okay, so this is the formula that was first constructed back in the Tang Dynasty. So that's 1,200 years ago, and it really stood the test of time because it's still used throughout China now. These patients also should avoid soap. So there's a bath oil, which they're prescribed instead of soap to use. If they have a bath, they can put a squeeze of this oily substance in the bath to coat the skin. So in her case, with that, only that approach, no internal medicine, you can see that her skin, over a period of a few weeks, cleared up. Okay, so this is another case. Also, these patients typically use steroids, so the skin doesn't look as bad, but when they stop using the steroids, there is this rebound effect. But here you see, because she's a youngster and she didn't want to drink internal medicine, she was just given external application. But you can see this eczema. They tend to be very stubborn around the eyes and the flexures. See how ill-defined it is. It sometimes doesn't even look very severe, but it can be very itchy. So she was also using steroids. And then there's nothing to say that in a patient, they won't have a combination of damp heat and hot blood eczema. In her case, if you see on the fingers, these are much better defined. And it's almost by definition, if you get eczema on the hands, the palmar aspect, then you have to drain damp heat. So if you're using internal medicine, you'd use things like Longdansao, Huangqin. And you see also how swollen the fingers are, where the eczema is. So she has hot blood with wind in the upper body, and she has damp heat in the fingers. So for the body, the face and neck and the arms, she's used the TSW lotion, which has this licorice extract. You use Mazin Shuigal, which is one that we often use for face. Although Shuzhen Shuigal, which I will also pass. No prizes for guessing what's in there. So this blue component is Qingdai. Qingdai, often combined with Huangbai, has very good effect at reducing inflammation. You can put your fingers in it as well, and if you wish. So Qingdai is very famous, both internally and topically, for its anti-inflammatory effect, you can say. So in modern studies, they find it interferes, especially with the TNF-alpha inflammatory pathway, which is very important in a lot of these inflammatory diseases. Okay, so she used that as well as the Tsao Shui Gao, this pink one, and as well as this bath oil that I mentioned. For the hands, because the presentation is different, we prescribe this soak. Three white powders. Yeah, and they add hot water to this, dissolve it, and then put their hands inside. Yeah, this is very common for this damp heat eczema of the hands. And then it's followed with the equivalent of this blue cream I'm passing around, but an ointment, which is better for damp heat forms. And then when the skin dries, which it will do, she can start using the nourishing cream, that pink one. And again, after a relatively short period of time, you see this what looks like a mild eczema actually can be very persistent, clears up without internal medicine. If you can see on the right-hand picture, there's a kind of pigmented area. So any inflammatory processes quite often will leave a tide mark of pigment when they clear. That's, of course, a good sign. And that's where that pink cream, the nourishing cream, is very important. Yeah, so that clear. And the hands likewise. And because you're, especially with this pink one, this this nourishing cream, you begin to not add ceramides to the skin, but stimulate the granular layer to produce the ceramides. Likewise with the filaggrin protein, yeah, which makes it really a much better option than steroids that do exactly the opposite of what they should be doing. Is this damp heat or hot blood, would you say? Yeah, this is very clearly damp heat. So there's crusting, there's yellow crusting, there's erosion of the skin. You see where the top layer of skin is missing, and it's well defined. Yeah, all signs of. So for this, we use what we call the honeysuckle wash. This is a Jinyanhua extract, which has actually been found to be really effective, not only as an antibacterial, but one that stimulates the commensal bacteria on the skin. So use that as a wash before applying the TSW lotion, the Shujengao, and then when the skin dries up, the pink one, the Zitashwega. So again, in his case, this is why usually we don't use the indigo creams for the face, even though usually they're the most effective, just because it's on the face. So we'd rather use this FRCHM cream. Yeah, but he puts up with it, and the eczema clears. And the same with the arm. This is another patient. Is this damp heat or hot blood, would you say? Yeah, damp heat. Why do you say that? Yeah, it's well defined. And actually, if we zoomed in, which I can't do right now, you see tiny little vesicles, little fluid blisters. And you get these what are known as satellite lesions all around. Yeah, that's a very clear sign of damp heat. So this is pass this out. This is the other blue one. You can put your finger in. This is the ingredient, the topical for damp heat eczema. Yeah, and quite rapidly it will clear with this application. This also, Qingdai has very good antibacterial action, and antiviral and antifungal. So it can catch all of these things. And often these, what we call damp heat in Chinese medicine, really will mean that there is infection as well. I'm just going to quickly talk about another form of eczema called Pompholyx eczema. Pompholyx comes from the Greek for blisters or bubbles. And this is a kind of eczema that affects the hands. In fact, we've already seen an example of it. But these patients just have eczema on the hands and sometimes up on the wrists as well. That's not actually an atopic eczema. But with these patients, you can see very clear blistering. I don't know whether it's big enough there. Actually, do you see? Yeah, you can see the blisters, yeah? Fingers are swollen, or clear sign of damp heat and toxic fire, we'll call it as well. Here we see big blisters forming. We call them bula. Even when these blisters or vesicles reach the surface, you can see that they're well demarked. Yeah, they leave behind their. And typically they will go through this very itchy active phase where there's a lot of fluid forming, and then they go into the desquamating dry phase, yeah, before the blisters start up again. This kind of eczema affects mostly the hands and sometimes the soles of the feet. So this is an example of an older lady who could not drink the herbs. The herbs for this type of eczema are bitter. You have to have these very bitter ones to dry the dampness. So she refused to drink it, but she was prepared to just use the external application. But you see how this is going through partially the dry phase. And the eczema also breached the hands and went onto the wrist. This is not a good sign. I really didn't have so much hope for her that she will get better with just external application, because she also had it on the feet. This is really widespread. Those patients usually need a course of internal medicine. But it's a very satisfying eczema to treat because almost always successfully treated with Chinese medicine. And actually, in contrast, Western medicine, where they use very potent topical steroids, and they have to be potent because the epidermis is so thick in those areas, are almost never resolved because it damages the skin in the process of using these strong steroids. Okay, so in her case, we have the white powder I mentioned earlier. She had to soak them, and then she used this shujangao, the blue ointment that I told you was good for damp heat. And after that, I prescribed Zicao Dampi Shuigao. This is the pink cream, but we add this pional that I mentioned earlier to make it stronger as an anti-inflammatory, yeah, because she was only taking external medicine. And in her case, she did, to my surprise, very well. This after years of suffering, and you can imagine patients like this are unable to walk far. They can't use their hands properly. It's a miserable existence. This is credit to Chinese medicine's insight into the ingredients that are effective at resolving this. And the same thing on the hands. And once things are restored to normal, the body takes over and is able to just maintain that. But you have to bring the body to that area and not using steroids, because steroids, as I say, actually in the end compound the problem. Okay. Next thing I'm going to show you is rosacea. Do you know this condition, rosacea? The rosacea affects the face, almost exclusively the face, sometimes the neck, and it does so in the sign of the cross, so the forehead, the nose, the chin, and the two cheeks. And there's a kind of background redness with telangiectasia, which means these spider marks. So in Chinese medicine, blood stasis becomes quite important quite quickly with those patients. Okay, initially, it's typically heat in the stomach. These patients often have gastritis as well. Yeah. And then it becomes stasis of blood very quickly. Okay, you get these papular lesions, little bumps, red bumps, and it's very persistent. They flush very easily. Actually, nowadays, it's considered an autoimmune disease. And then you get pustular lesions forming in some patients, quite pronounced. Okay, this needs to be differentiated from acne. Here we see the telangiectasia and the pustules on the nose. and in active phases, because they often will go through an active phase and then settle down again to, doesn't disappear, but it just becomes less active. But the active phase, you get scaling and swelling of the tissue. So what we've done is to publicize free treatment for patients if they are willing to be photographed for rosacea and just use the external products. This is one such patient. So she came in with, she's had rosacea for about 8 years. You can see a typical presentation across the nose and the cheeks, papules, around the chin area, and a tiny bit on the forehead. So what we do with these patients, we get them to wash with this honeysuckle wash. After that, they apply this pinch. This is very interesting. Important ingredient is baibu. You know this herb, baibu? So what's baibu used for? For lung, yes, lung. But there's another very important function. Is it they call shachong? It kills insects. This is the translation in Chinese. Yeah, and what happens? Patients with rosacea have a profusion of the Demodex mite. So we're covered inside and out with living organisms. Well, amongst those trillions of living organisms, amongst them are little mites called Demodex mites. And they live inside our pores, especially the face. So everyone has them. The females usually stay inside the pores, and the males at night crawl out and go and look for females and enter the pores. And most people don't like the thought of this, but if you don't have them, you're in trouble, actually. But what happens with rosacea patients is they have too many of these. And this is part of the pathology of the condition. So it's not the causative agent, but the changes that occur in the skin mean that these mites love to procreate. So what's been found is this baibu is one of the ingredients in that tincture, kills them off. So you apply that first of all to the skin. When it dries, you put the jiujia. Jiujia in Chinese is a traditional Chinese name for rosacea. That's why the name is called jiujia ding. Ding is the tincture and shui gao is the cream. So once that happens, once the skin dries, cream is put on. For pustulin, for acne as well as for rosacea, we use this one. Diandao cream. Diandao means upside down. And it's a traditional combination of using sulfur, liu huang, and da huang. It's called upside down because one is very hot, sulfur, and da huang is very cold. And this combination, used topically, is good for pustular lesions. Actually, it has other ingredients in it, including the huangbai and huanglian and such like. So that's very good for drying out spots, whether it's from rosacea or whether it's from acne. Yeah, in her case, she had 6 weeks of just using topical treatment. And you can see it's significantly improved. It's not totally cleared because you really need internal medicine for these patients. But I had to dig to find patients who only use external treatment. Yeah, otherwise most patients that I see are get internal medicine. Right, so that's rosacea. So we have this thing that kills off the Demodex mites, but also other ingredients. I don't have much time to go through what these are, but they're effective at subduing the rosacea. So psoriasis, you all know psoriasis, yes? Yeah, if it's also autoimmune disease, been known in China since antiquity. Yeah, it goes under many different names, including pine bark lichen. Yeah, pine bark named after this beautiful pine tree that's grown in China for its elegance and its beauty. Yeah, because the bark of the tree looks like the scale of psoriasis, so-called pine bark lichen. So this condition, unlike the eczema that we talked about, it typically affects the flexures. This affects the extensors, the elbows and knees, and they're very well demarked. But in this case, it doesn't mean it's damp heat. So depending on the disease, you have to have different interpretation of what the lesions mean. Yeah, so typically on the elbows and knees, but actually anywhere in the body. The scalp is a very common area. Typically just stands inside the hairline. Where you see this woman who shaved her hair, you can see the psoriasis widespread, exactly where the hair should be. Yeah. So psoriasis is a complex disease, and really you need to treat it with internal medicine, but external topical application is definitely very effective. So most patients who apply the topicals regularly will start seeing change within a week or 10 days. Okay, so this is another older lady who, again, refused to use internal medicine. She couldn't drink the medicine, but she was very diligent about topical application. Here we see she has quite widespread psoriasis, so on the knees, the hips, the buttocks, and the legs. So in her case, you can see all those varicose veins. A lot of treatment in Chinese medicine will include ingredients that invigorate blood, but certainly to cool the blood and clear toxic fire from the blood will be very important. Yeah, so it's quite widespread in her case. And this is like a standard treatment for all patients with psoriasis. During the day, they put this one on. Baibi is another name for psoriasis. So it's called Baibi Dao and Baibi Dao. So that the lighter one is put on during the day, and the other one's put on at night. This, of all the creams and ointments and lotions and things that I've made over the years, I'm proudest of this one because I'd say 75% of patients with psoriasis, when they use it, they will start seeing change within, as I say, a couple of weeks, let's say. Yeah, and they, especially if they take, we call it cling film, saran wrap, you call it. And they, let's say it's on the elbows, they put the ointment on at night and cover it with the cling film, leave it on overnight. In the morning, the skin is smoother and thinner. One of the problems with psoriasis is hyperproliferation of the epidermis, so the skin becomes much thicker. But it reduces inflammation and reduces growth of skin very rapidly. This is really useful because with all these topicals, if patients are able to use something that immediately you can apply to the diseased area, they will see change and they will trust your treatment more. So they want to see something. If you give them just internal medicine, you need to wait 6 weeks to see clear change with psoriasis, typically. But with external, you see it much more rapidly. But here you can see that apart from the post-inflammatory pigment, much of that psoriasis is cleared. The hips likewise. Yeah, this once the inflammation is clear, you're left with this tide mark. But if you ran your finger across the top, it will be smooth. That's the important thing with psoriasis, because it's excessive growth of this epidermis. Yeah. So I tried to convince her that really to mop up these last little bits, which are important when you treat psoriasis. She'll need internal medicine, but she was adamant. She was happy that it was 80%, 90% better. This is another patient. So a lot of these patients with psoriasis come with just psoriasis in the scalp. So there is, and around the ears, very common. If they have it nowhere else, the first port of call is just to use this we call BiB shampoo. BiB is an old name for psoriasis. Yeah, and they can use, Urju, this. So Urju oil, when you extract the oil from that, that's very effective for psoriasis as well, topically. So we use that a lot. So they wash with the BiB shampoo 3 times a week, and they leave it on the scalp for 10 minutes before they rinse it off. And then they apply this ointment, Urju Gal. And the reason we use that rather than the BiB Gal, which is the blue one that we saw, is because of the color. Yeah, so this Urju Gal has no color to it, so they're able to use it on the edge of the scalp. But in his case, in about 8 weeks, his psoriasis cleared. Okay, so that's psoriasis. Acne. So acne is a very common condition. I see hundreds, thousands of these patients. So it doesn't need any introduction. It's almost physiological in teenagers, but acne can also be seen in older people, especially women. So in their 30s and 40s, people can continue to suffer with acne. There are many subforms of acne. And when you treat internally, it's really important to differentiate the different types. You can even get acne in babies. Yeah, this is from the maternal hormones, actually, that stimulates sebaceous glands. So sebaceous glands are glands inside the skin that produce sebum that are implicated in acne problems. So sebaceous glands are not active until puberty. Yeah, they're inactive in children. But under the effect of testosterone, androgens, they're stimulated into working and producing sebum. But when you see it with babies, then that's because they've got the hormone from their mother. So this will clear of its own accord. So for simple acne, again, it's worth just using external because it's very effective. So here we see a young woman with acne of the forehead. It's simple in the sense that it just sits on the surface. It's not deep-seated cystic acne. This is the common, simple type of acne. In Chinese medicine, mostly we treat it by clearing the lung from heat and sometimes the stomach. So in those patients, then the Jinyanhua wash, this honeysuckle wash is essential, and they need to use that twice a day at least. And once they've patted the skin dry, they use that upside down cream that I passed around, that yellow one. And at night, because it's yellow and smelly. And then during the day, they use this Jishetao cream. You know Jishetao, this ointment, this medicine? It's it's quite famous now, called Centella Asiatica. It's Jishetao. Jishetao, #1 medicine for pustular lesions. for acne. Yeah, both externally and internally. So jishe sarshega. So she used at night, use the yellow one to get rid of the pustules, and then during the day, because this is white, it can just disappears into the skin. So they use it. It's actually in China also. It's used a lot for eczema. Very good anti-inflammatory. Mostly I use it for acne, but you can certainly use it for any inflammation. Not so much psoriasis. And then this rose otto, actually, this is the, we call it the rejuvenating cream. Have you heard of bakuchiol? No, okay. It's not retinol, but it's the equivalent of retinol in Chinese medicine. So bugujir, you know bugujir? Yeah. So what we do is we extract one component of bugujir, which is famous for potentizing UV light, and we use it for vitiligo. So they apply this to the skin, and then it makes the UV light that enters the skin much more potent. The other component is now called bakuchiol from bugujir. And there was a study that was done about 5 years ago and published in the British Journal of Dermatology, which compared retinol. You know retinol? You know this? It's a vitamin A derivative. So this is, everyone agrees, retinol is able to stimulate the growth of collagen in the subcutaneous tissue, is able to clear blemishes from the skin. You apply it regularly, after a while, these what are called liver spots can decrease. And because it stimulates collagen growth, it gets rid of superficial wrinkles. Yeah, this is well known. The problem with retinol is, in order to use, you have to first grade it gradually. If it's used, it has to be used step by step, because if you use too much too quickly, it triggers inflammation. Yeah? So it makes it not so useful. And if people use it for over a period of time, that inflammation is more likely to occur. If they go and expose themselves to sunlight, that also aggravates. So bakuchiol, which is this extract of bugujir, which is in that rose otto cream, was put head to head with retinol, and they found it had exactly the same effect in terms of stimulating collagen, in terms of getting rid of blemishes, but also it has anti-inflammatory effect. It's very good for acne because it controls a bacteria that's associated with acne. So it has all these functions, but without any side effects. This was the incredible thing. In fact, that study was using 0.5% of bakuchiol. In this cream, we put 1.5%. Yeah, so it's the number one bestseller next to that pink cream that I started with. So often for acne, for clearing the blemishes, or even for the active acne, it's very effective. Yeah? So that was prescribed for this girl, for this lady. And also to clear pigment, yeah? Because once they have the acne, it leaves this mottled look. And this was the case in her in about 8 or 9 weeks, I think, her skin cleared. For more aggressive acne, topical on their own won't be effective, won't be enough. We prescribe similar things for nodular cystic acne or for more widespread acne, but internal medicine is necessary. Here we see it on another patient. Again, the same kind of thing. There's also a mask we use, we call Kamwo. So this is a acne mask. So just apply it to the face 2 or 3 times a week, leave it on for 20 minutes and then wash it off. This is very popular as well because it's effective. Otherwise, the same kind of combination. So with these simple acne, as you see here, again, it clears within a few weeks of application. Okay, time-wise, it's 7:30 now. So, okay, I think just a couple more things and we can finish there. Yeah? So this is, do you know what this condition is called? It's very common, seen in women, called perioral dermatitis. Actually, this condition didn't exist before the 1960s, or nobody ever spoke about it. And in Chinese medicine, it was never mentioned. And you know, in Chinese medicine, by the Qing dynasty, 360 skin diseases were named, had names assigned to them. And these names pretty much echoed modern dermatology's naming, because psoriasis is not called psoriasis, but they call it Bai or they call it Baixian form, the lichen, the number of different names, but they gave them the names that really are almost exactly the same categories as Western medicine. Because even in Western medicine, the way they diagnose disease is primarily by visual inspection. But 360 diseases, that's a lot of diseases. But this was all done and dusted a few hundred years ago, by a few hundred years. But this disease did not appear. And this first appeared in the 60s when people used topical steroids. So initially it was just associated with use of topical steroid. They'd use it, and when they stopped using it, the rebound effect will create this kind of rash with the micropustules and micropapules, little tiny little bumps, typically around the mouth and the chin. And one of its features here is it spares what's known as the vermilion border, this area just around the mouth. You see how it is there? It doesn't encroach in that area for some reason. Yeah, and it's sometimes also around the eyes, as you see here. It can be very stubborn and persistent. Yeah, so this mostly you can treat this with extra topical application successfully. So here it is on the side of the mouth. So in her case, again, the honeysuckle wash is standard. And then you can use Jisha, this centella cream in the day, and the Wusher Ga. Wusher Ga is a famous ointment that was also blue-gray. So we typically get the women, and this is a condition that affects mostly women, to use it at night because it has a color. And then in the day, they use the centella cream. And then again, the Rose Otto, the rejuvenating cream, is effective because it reduces inflammation. Okay, and I think this is the final thing is tinea, which is fungal disease. And fungal disease of the feet is very common. And there are a number of different variants of it. This is called Trichophytum rubrum, where you get lots of white scales forming. Can affect the hands, but less commonly. Yeah, mostly the feet and between the toes. Can be very persistent in these patients. One of the features of tinea, of fungal infection, is it's asymmetrical when it first affects people, because this is a fungal spore that lands on the skin and starts growing. Diseases that are endogenous, internally generated, will be symmetrical typically. Like you have psoriasis on this side and this side, or eczema on both sides. With fungal infection or bacterial infection or viral infection, it doesn't follow that rule. That's one feature. The other feature of tinea is it has this leading border. So you often get patients with what we call an annular lesion, which means hollowed out in the center. Here you can see it on the side of this man's thigh. See how he's got a advancing border? Here it's asymmetrical with an advancing border. Here it's more widespread, but you can still see that advancing border. It can affect any part of the body. Yeah, if it's widespread, then internal medicine is needed, but for simple forms, topical is very effective. Often these patients also use conventional external applications to kill the fungus, but it keeps coming back because the fungus gets used to the antifungal component. Whereas in Chinese medicine, usually these compounds are multifarious, there are many different active constituents, so it tends to be more effective. So this patient, this man, had fungal infection of both feet. I don't have an example of this, but something we call supple, which is a vinegar soak. So it's a vinegar that we soak herbs in, and then we bottle it, and then the patient each day puts their feet inside this for 20 minutes, 15, 20 minutes. And then once they dry, they put this Tishanggao, which is the ointment. And for fungal infection of the feet is really effective. This is halfway through. This is so quickly treats it. This is another patient. Again, you can see it's one-sided. It has this leading border. But look at the nails. The nails have fungus. That's actually, this is the easiest type of nail fungus to treat because it just affects the top of the fungus. If it goes underneath and begins to infect the nail bed, you need a very different treatment. But in this case, you had the supple, the soak, and then something we call yadanza. You know yadanza? You know the seed? So we extract the oil from the seed, and you can apply it to the nail. And in his case, you can see that treatment was very effective. This yadanza oil we also use very effectively for warts. Yeah. Okay. In fact, yeah, this is another. This is a fungal infection. You see how it's hollowed out in the center. So it's a simple one, which case you just use the tincture, Tishan Ding, we call it, and then Tishan Gao once the tincture. And these are easily killed off. Okay. That's about an hour, yes? Oh, good. Okay. So if you have any questions, I'm happy to answer.
So patients where once you clear the heat or the dryness, does it reoccur? And the reason for the question is that like there was something that caused the heat or the dampness to be there in the first place. So if you clear it and they're not addressing the initial issues that cause the heat and the dampness to retain in the body, does it recur? Do you see patients?
Yeah, I mean, it depends what disease you're talking about. For example, eczemas and psoriasis and acne and rosacea, these are actually quite significant conditions. A lot of patients with eczema will start in early childhood. So there's something in their system which is not functioning well. But most certainly, once you restore normal function, for example, to atopic eczema, which is a very well-treated condition in Chinese medicine, you can resolve it and stabilize for many, many patients. But they need to make changes to diet, for example, is really important. They need to look after themselves in order to maintain that. From Chinese medicine point of view, once you've cleared that heat, let's say it's hot blood with wind, once you've cleared the heat and you've scattered the wind and you've restored normal function, you should then use medicines that supplement and tonify the blood and the yin in order to secure that. And also actually quite often invigorate blood. A lot of studies in China now show that using herbs like danshan have the effect of restoring tissue to normal once the inflammation is clear. So there are lots of tricks like that too. But in essence, you can say that you first drain, as you clear the heat and the dampness and the toxin or whatever is there. Then you harmonize, which means you begin to restore function to the body. And finally, you tonify, which means you consolidate that change by nourishing and supplementing that's being damaged by that long-term heat or that predisposition that they have as well. Yeah. Yes.
About how you approach vitiligo.
Vitiligo is an autoimmune disease. It's a difficult disease to treat, but it's worth treating. I would say if a patient, the best results are achieved in younger people, in patients who've not had it for more than 5 years. And there are subforms of it, which are more easily treated than others. So counterintuitively, vitiligo of the face is relatively easy to treat. Vitiligo of the hands is difficult to treat. But in essence, the one that I've had most results with are what we call disharmony of qi and blood. Actually, it is often triggered by emotional component and a number of features you need to see. There'll be what's called trichrome vitiligo, which means they have areas that are totally denuded, white, porcelain white, areas that are partially denuded, and then normal skin, of course. And this is because the vitiligo is still active. The ones that are most difficult are the ones where there is deficiency of qi and blood and kidney and liver. So they've had it for a long period of time, or it's in their family. Often it is in the family anyway. But basically, young people, children, you get it often with children, you can get some good results and it's worth treating. People who have had it for more than 10 years, 7 years, let's say, it's very difficult.
Adults just
Yeah, no, that's, yeah, then it's definitely worth treating. It's a difficult, compared to eczema, like, for example, atopic eczema, I'd say we expect really 80%, 85% of patients get better. Psoriasis, maybe 75% of patients. Vitiligo, depends which type, but it's more like 35%. But it's worth, in the early stages, it's worth treating. Where does this patient have the vitiligo? Just one patch. Oh yeah, definitely. Oh yeah, definitely. Definitely worth treating. If they have white hair within the vitelliginous area. Yeah, so this is the melanocytes in the skin are attacked by the immune system and destroyed. And the hair follicles are a reservoir for these melanocytes. So they often repopulate from there. So if the hair is not white, you get better result. Yeah, that's good. And then topical as well. I mentioned this bulgujar, so you apply that, then you expose it to UV light, a narrowband UV light. Yeah. Any other question? Yeah.
It said they need to stay on the externals for acne long-term typically.
No, I mean, it depends. You see, for acne, I'll make a really big deal of diet. These young people are eating just junk food, are eating refined carbohydrates, a lot of sugars. This is now shown really to be a trigger for acne. Sugars, sweet foods, refined carbohydrates, they need to change all of that. It's a kind of rite of passage acne. They go through a phase where, you know, the system is unable to cope with all the extra energy that's being produced, you know. The machineries can't do it, so it just bubbles up everywhere. But as they grow older, then it can settle. But you can certainly restore function much more quickly by eating well, as well as topical. But the best treatment, like with all these things, is internal as well as topical. Any other online questions? Yeah.
I have a client that has a rash, and he was diagnosed by one doctor as eczema and by the other doctor as psoriasis.
Yeah, and they're
I'm sorry. For the questions, for the online people want to make sure they hear it.
oh,
So if you
okay.
can just
So the
speak
question
louder,
is,
repeat.
okay, the question is one doctor diagnosed psoriasis, one doctor diagnosed eczema. Actually, usually they're mutually exclusive. If you got eczema, you don't have psoriasis. If you have psoriasis, you don't have eczema. Very rare you can have kind of a combination of the two, but it's very rare. I'd say mostly it's the doctors doesn't know how to diagnose it. Yeah, without seeing the patient, it's usually very easy to differentiate the two conditions.
Are there any distinguishing features? So you say definitely.
Psoriasis is always really well demarked. I mean, I've mentioned with eczema, you can have poorly demarked or well demarked, but the well demarked eczema is never as well demarked as psoriasis. Psoriasis, you can put a pin between psoriatic skin and normal skin. That's how close it is. And then there's a number of other features, which maybe we can't talk about now, but if you scratch psoriasis, scratch the skin, you get what's called the three-phase phenomenon. You get first the scaling, very clear scaling, called candle wax phenomenon. And then you keep scratching, you get to what's called the last cuticle phenomena, which is actually very characteristic of psoriasis, which is just like a moist layer at the junction of the dermis and the epidermis. And if you scratch a bit more, you get what's known as the auspice sign, which is also typical of psoriasis. And that's a pinpoint bleeding. So for eczema, you won't get that. That's all. But you'll have to know what that is. You have to be shown what it is. But it's a good way. And then distribution is really important. With all skin disease, distribution will give you a big clue. As I said, psoriasis typically affects the extensors and the scalp. Eczema typically, atopic eczema, there are many kinds of eczema. Atopic eczema, typically the flexures. Eczema is usually very itchy. Psoriasis may be itchy or may not be itchy. There's, yeah, many features. But really, if the doctors are confused, and my experience is quite common, if they're GPs, they get a day or two of dermatology in med school, and then that's it. So they don't really know.
Which topical is the most effective for liver spots on the face?
Which topical is most effective for liver spots? Okay, I would say, nowadays, I would say this Rose Otto, this rejuvenating cream with the bakuchiol, because they have to keep using it. For a few, let's say 2 or 3 months, but no question about it, it will fade pigment. Yeah.
Question is, which topicals are pregnancy safe?
All of them. All of them. They are definitely all fine. Breastfeeding and pregnancy.
So I think retinol is counter-indicated for sun.
Yeah.
The rose
No,
can be
is
worn in the day.
that's the other thing. It does not, not triggered by. It really is superior. I mean, if you Google it, you'll see there's a lot of people jumped on the bandwagon because it's it's the natural retinol.
And it feels really good
Yeah, it's a
on
good
the
cream.
face.
It is. It's a good cream. It's a good cream.
psoriasis from the biologic, that's gonna be like less well defined, is that right?
It's going to be
Less well defined.
treating. So the question is, I'm not quite sure. So a person's got psoriasis and they've been treated with a biologic.
They have eczema treated with biologic. And then they break out with skin that turns over very rapidly and has the pinpoint bleeding over.
So it becomes, yeah, you can get this. So the basically biologic is triggered, was used for eczema, maybe Humira or something like this, and it triggered a psoriatic response. Yeah, the trouble with biologics, and this is really, it highlights the difference between Chinese and Western medicine. In Western medicine, there's always the desire to find a single compound that will interfere with one component of the disease, as if disease is made with one component, and resolve it. But because, and it may be a steroid or a biologic or any of the other, not all, but most treatments are of that ilk. So if you block something, like with the biologics, they will block a TNF alpha pathway of inflammation. If it happens to be that patient's main pathway of inflammation, it will block it and their skin will get better. But very often, it's like you block a water flow. After a while, it may start flowing somewhere else. So it'll trigger new components of inflammation. I mean, not always by any means. And in fact, you get patients who do very well with biologics for extended periods, but there's a real danger, or there is a danger, and I think it's not quantified how problematic that is. But, and I've seen patients like this, where basically it creates multiple problems as a consequence. So this is what you're describing, I think. I mean, if you're, Chinese medicine terms, if you presented with a patient with eczema, let's say they have heat or toxic fire, and usually it's a combination of different things. Your job as a Chinese medicine doctor is to recognize what the components are and mirror that with the formula to resolve it. Once you've resolved it, that's stage one of treatment, because then you have to change the formula because the patient has changed. If the skin is cleared, you can't continue to use bitter or cold or acrid medicines to resolve it. In Western medicine, that's done all the time. If something works, then they'll give you the same treatment over and over again. Maybe they try and reduce the dose, but that's it. Because if they stop using it, everything comes back again. In other words, they've not really reached the source of the problem. In Chinese medicine, as we know, when the patient gets better, starting to get better, you need to change the formula and escort the patient from point A, which is disease state, to point B, which is stable, and point C, where you restore and recover the body. Because you hand over the responsibility back to the body. The body is able to, I mean, it's a kind of birthright that it knows what it should be doing. And if it's lost its way, then that's the job of medicine, is to bring it back in place and then anchor that. Yeah. So this is definitely seen clinically, that you can resolve patients over and over again, whether it's ulcerative colitis or whether it's psoriasis or eczema or all of those conditions, by going through those stages.
Have a patient on a mouthwash for lichen planus exclusive to her mouth. If symptoms clear, should we then focus on diet and discontinue and simply keep on hand if there is a flare?
Yeah, lichen planus is also autoimmune disease. And if this patient only has it in the mouth, they often mouth and genitals, or systemically. There are many different subforms of lichen planus. Generally, something topical with a condition like lichen planus, topical is not enough usually. But if the patient does well and looks after themselves and eats well and so on, and that's good, and it disappears, that's very good. If not, then you need internal medicine. If you had to choose one medicine for treating lichen planus of the mouth, it would be Qingha. Qingha is famous for treating lichen planus of the mouth and the genitals. Any other questions? All done?
Okay. Thank you so much for everyone coming. If you don't mind.
Thank you, doctor.
Yeah, we'll take a, do you mind if we just take a group photo before we leave? And yeah, if you have any, like, I know some people wanted to buy products, can always help with that too. But yeah, thank you so much.
So the stop sharing. There you go.
Yes, you can stop sharing.